All right, well, good day, everyone. Welcome to our San Joaquin Valley Health Fund Health Committee presentation, The Valley Rising After Impacted by COVID-19. We appreciate you taking the time to join us to learn more about the health disparities that have been impacting the Central Valley for decades. These disparities were exacerbated by COVID-19. They were not new to the Valley. After the video and our presentation, we will have a roundtable to answer any questions you may have and to talk about collaboration beyond equity on the mall. Thank you. Also, for those who need interpretation, please make sure that you go to the bottom of the screen on the Zoom meeting where it says there's a little round ball that says interpretation, and you can access it through there. So like that, you feel comfortable. So, si necesitan interpretación en español, por favor de mirar abajo, donde hay como una pelotita que dice interpretación, y allí puede conectarse con alguien que pueda interpretar la presentación para usted.
The San Joaquin Valley is truly on the rise. I don't know when I have been prouder of my roots than right now.
Equity on the Mall brings together San Joaquin Valley community leaders, residents, and statewide partners to hold policymakers accountable to their constituents and their needs in advancing the health and equity of all San Joaquin Valley residents.
In years past, hundreds of organizations and thousands of constituents have traveled to Sacramento to convene in person, bringing our health policy and systems priorities to the Capitol.
Last year, Equity on the Mall was postponed due to COVID. We were unable to travel to speak in person with our representatives and to address some of our region's largest inequities.
This last year has highlighted the gaps in access to necessary healthcare services, technologies such as reliable broadband and the internet, employment opportunities, unemployment and low-income benefits, affordable housing, and diverse, culturally informed, and linguistically appropriate resource providers.
The San Joaquin Valley and its people have been hit hard by COVID-19 pandemic. In 2020, the leading cause of death for residents in the San Joaquin Valley was COVID-19. And the distribution of COVID-19 vaccines has been inequitable for immigrants, farm workers, and Black Indigenous people of color.
Our partners have approached these disparities by advancing community and workplace COVID-19 outreach projects, public awareness campaigns, and regional response funds, all of which target the gaps in care and resources that our communities have faced since the beginning and before the pandemic.
Our virtual bus tour seeks to shine a light on the work and the effort in our communities to improve the health outcomes of some of the most vulnerable in our state.
When the pandemic hit, it was scary. It was scary because we knew what was going to happen to our vulnerable community. When I drive around and I'm going to the businesses and some of the mom and pop shop that we used to go to, we order supplies from there with our different ethnic programs that we provide to our community. And to see them close their door, not able to come in and open their shop to provide services to our community, it's heartbreaking. As a community-based organization, an organization that serves our community of color, especially here in Southeast Fresno, which is one of the poorest regions in Fresno County, how are we going to face this virus face time? How are we going to still open our door, protect our people, and provide services to our community? That was the first thing that came to mind because of the amount of services that we provide to our community. Every single services that we have here at the Fresno Center is essential, especially our mental health clinic, our prevention, early intervention, holistic education and wellness center, our welfare to work mental health assessment program, our immigration program. These are essential services that our community continues to need, even more so now in the pandemic than ever.
Medicare có mấy tiền của nhà bị chịu các chung và kết quả cho hạ sản của tôi này các chuyện sao xem ra sản cái quả ấy chỉ xem và mấy sao làm cũng chỉ ra cả vài sen cho cái sao vài xem những của tôi là tôi tiền ra những cái là mấy đàn ra mấy xem nhá chỉ sao mấy xem nhá Sara chara mi sha ora mi sita sera mi ja e mi in mi quarto ora mi tashin ta menya in kanya chinzia ju mi chinera. Akunda in ushe me tu purashni sora un me kunda mi sha in señor sin tu piaso. Chinzia ni achi tunda bi ka abaso se ni kunda in ne shi ya chinyo na irero wa nyoma Nyang za ka ba ku anzi anyo ya kunta bi ka ba na so ku anzi an kunta bi jar ko kunta in nyanyara kunta me yor kunta tu sha ta ka yo ne ti be kunta ba ne na ka tu na ti be na su sa me na ke yor ko kunta wa be nyanya ko ta ka tu kera ko kunta kwa bi in me tu ka tu ra sa se ba kunta bi ka ne ka i bin si ara medical va escuela va mecánica va ni va con ni se me na ka tonta de ni va y apoyo chica isa.
My name is Saban Chan. I'm originally from Thailand, now living in Fresno, California. I'm a client and friend of the Source LGBTQ+ Center in Visalia. You know that Alanis Morissette song that says, just when everything is going right, life has a way of sneaking up on you. That was 2020 for me. It was a perfect storm in my life. My relationship ended. I was having health issues and COVID-19 hit. I wasn't able to work. I wasn't able to get my recovery meetings. I felt separated from my friends, so I reached out for help from the Source, HIV support, AIDS drug assistance program, COVID relief fund. I was able to access rental assistance, income assistance, mental health, group support, food, hygiene. I needed it all. At the height of the pandemic, they met me halfway so I can get the help to keep my home. I wish there had been a Source when I was younger. I could have used peer support group, recovery services, access to mental health, community events, HIV programs, and leadership academy. Growing up here was hard, and I felt so alone. The Source has changed that. It is a beacon of hope for the LGBT+ youth and people just like me.
Hi. This isn't where we thought we'd be this time last year. Some things have stayed the same.
Our patients can't wait for essential medical care.
Like behavioral health, STI screenings, gender-affirming care, cancer screenings, and abortions. We are leading the charge in addressing public health crises in our communities.
Planned Parenthood Marmonte continues to be a safe haven for those seeking confidential and affordable services. We're rising to the challenge with solutions like curbside pickup,
Recharging.
creating a place to change in and out of our scrubs each day.
Continuing to offer therapy services to our patients in order to support their emotional stability during this time.
We have launched telehealth to give our patients the face-to-face care and attention they deserve without unnecessary risk.
We are making sure that you have access to the prescriptions you need.
we are still taking calls to ensure that our patients get the answers and the care that they need.
We have converted our in-person outreach and canvassing activities to virtual engagement to educate about the importance of participating in the census and being civically engaged.
We work closely with our community allies to support first responders and others who are on the front lines.
We're on the front lines of COVID-19 testing for our community.
We've converted our in-person sex ed programs to virtual classes led by our trusted educators.
We will do everything we can to get you the care that you need.
Our doors are open to everyone, sin importar qué lenguaje hable, or whether you have insurance or not.
No matter where you live,
From the sea to the others, no matter who you are, we're all in this together.
We are in this together.
we are in this together. We are in this together.
The COVID-19 pandemic has highlighted and intensified the health inequities that low-income communities of color in the Valley have suffered for decades. Work with us to ensure lessons learned and the millions of lives lost were not in vain. We need to support and pass legislation that addresses these inequities beyond COVID-19. Great, thank you so much, Ryan. So during the San Joaquin Valley Health Committee presentation, you will learn who we are, who are providing services throughout the San Joaquin Valley addressing health disparities. You're going to learn about our work and what we're doing to achieve a healthy Central Valley and what are our legislative priorities to get us there and how we can work together and what are the next steps. So, hopefully you'll stick around, be on our presentation during the roundtable so that, we can answer any questions you might have and have a really great discussion of how we assure that, these decades of disparities don't continue. And that, fortunately, one day when we are coming to Equity on the Mall again, it's more to thank our elected officials than anything. So then now we're going to move on to Noe.
Can we share the screen with the orgs?
Next slide. There we go.
Thank you. Thank you. Hello, everybody out there in the virtual Equity on the Mall 2021 visit. And what I'd like to do right now is just introduce to you the Health Subcommittee organizations of the Policy Committee for the San Joaquin Valley Health Fund. And here's the list of all the organizations from San Joaquin County down to Kern County. And these are the organizations working tirelessly for the past year on issues impacting residents, families, regardless of immigration status, whether you're documented, undocumented, and the aspect around COVID-19, it hit real hard on our communities. Just the numbers and deaths are just alarming. And the data is proving that we got hit really, really hard. The government, state government addressed this issue by putting additional resources into the Valley. But it was our support from the Sierra Health Foundation, working with the community-based organizations, these organizations on the ground, helping lift up our residents' feet during this difficult time. And just those with asterisks I would acknowledge are our ad hoc committee that came to develop this presentation today. So here they are: Children Now, California Rural Legal Assistance Foundation, Planned Parenthood, Marmonte, the Source LGBTQ Center. We have also CDBIO, Centro Binacional para el Desarrollo Indígena Oaxaqueño, the Fresno Center supported, Haven Women's Center as well. So thank you, all of you, for helping make this possible today.
Great. So as Noe mentioned, there is a great work that is done to really build our vision of what the Subcommittee of Health wants to see. And our vision is to strengthen and build upon Californians' commitment to and momentum towards increased access to high quality, affordable, culturally and linguistically appropriate physically and behavioral health services, regardless of race, ethnicity, immigration status, age, sexual orientation, gender identity, and other social, economic, and demographic factors, so that California has the opportunity to thrive. So this is our vision. And our mission as a subcommittee is some of those challenges that we are working, all of the organizations mentioned, and beyond that, to really address that disparitely, I can't say the word, impacted by environmental, economic, social, and access to care obstacles and adverse conditions that negatively affect the health of our residents. And as obstacles over and over again through this presentation and through the videos. Our next slide tells us that, COVID has really exacerbated what we already knew, where disparities around our community that really target, our more impacted communities. And we know that, COVID-19 in 2020 was the leading cause of death for San Joaquin Valley County residents, in that we know that access to testing, vaccination, and resources has really lagged in the Valley. And that, again, it continues to hit our communities disproportionately. We also know that many of the services that that come to aid really focus and exclude our undocumented communities in the Valley. And again, we continue to fight that, and I know that the state is doing, and we're pushing and want them to do more to address that, as immigration continues to be the vulnerability of our communities. We also know that Kern, at least in Fresno, Kern, Madera, and Tulare, we rank among the top 10 counties for health outcomes. And we know that from our population, 2 out of 5, that's 4.2 million people who live in the San Joaquin Valley at enroll in Medical. That is, again, not only 44% of our population. And we also know that we lag many services that support our community and that allows for access to care, even around physicians. We know that in the San Joaquin Valley, 39% per 100,000 population, that we have 20% below the state average of 50 primary care physicians for 100,000 residents. Again, this continues, and when we have events or pandemics like COVID or the fires or any other disaster, that we need to be prepared, and we know that we are still behind. And that's what a lot of the work that this committee is doing to ensure that we get equity and really justice around the health care system. So the next slide will really talk about our pathways, and I'll leave that to Noah.
Yeah, so as Sarah mentioned, is that there's a lot of inequity in the COVID-19 response, and that's including the vaccination effort as well. So there are a lot of pathways that we can take to respond to COVID-19, and one of the biggest ones right now is to ensure an equitable distribution of the COVID-19 vaccines, amongst other relief resources to the communities here that have been hit hardest, which is many of them here have been hit hardest, including immigrants, undocumented workers, as well as just general Black, Indigenous, people of color, and a lot of people from the lower class. So we should also ensure that youth and adults alike are able to access behavioral health supports necessary as a result of the public health emergency. There's been a huge influx of mental health crises, as well as issues that have plagued the Central Valley. That's something that we've seen a lot of. And the support from providers and just from general attention and coverage is not here yet. We also need to support policies that will address food security issues experienced by families and individuals as a result of the public health emergency. And we need to expand broadband access for residents to reach healthcare services. There's been a huge digital divide between rural communities and urban ones that have cut off a lot of people from reaching vital telehealth services that many other people can enjoy, whereas others are totally lacking in simple broadband access. So there are pathways, there are ways that we can mitigate these disparities that COVID-19 has caused, many of them that were there already. And so these are just a few of them. And then I'll pass it to Noah.
Thank you, Noah. Um, mi nombre es Noé y como dicen en inglés es Noah. So todos dos estamos aquí, dos, Noé y Noah. Y antes era Saraí, so gracias Saraí para la visión. Thank you, Saraí, for the vision that you provided. And as we know, we have to look at these issues and challenges that we identified as pathways. And how do we do that? Well, we need to make them a reality. We need to make them practical. We need to turn them into policy. And then we need to educate our officials and public officials and elected officials to inform and educate them on we need these policies to help our residents regardless of immigration status in the San Joaquin Valley. So the pathway number one, COVID-19 health equity, we want to ensure equitable distribution of the COVID-19 vaccines. We've been working very hard to do that. We've seen the state has allocated vaccines, particularly to farm workers. Community-based organizations are on the ground making sure there are pop-up clinics happening to get vaccines in arms all over the San Joaquin Valley. And a couple of the areas that we're focusing on and that we're learning and also that we want to continue is legislation. SB 558 by Senator Caballero proposes to convene the Farm Worker Disaster Relief Planning Task Force with the state and farm worker community advocacy representatives to examine the needs of farm workers, their families and communities on equitable access to healthcare, safety net services, protections, and other social and economic relief during the pandemic and other disasters such as fires and drought. The task force will report its findings and recommendations to agencies involved, the legislature and the governor. And this is a result of, because we found there are gaps that have resulted from COVID-19. So we want to close these gaps and convene the community-based groups on the ground, along with agencies and the state and the officials and counties to address these issues and provide policy for our communities. This bill is currently in the Senate Appropriations. It made it out of Senate Health and Senate Human Services on a pretty unanimous vote. So this is a good bill moving forward. And we need to educate and inform our policymakers that we need this bill going forward to help our community. Other bills that we're addressing, and these are the Health for All bills. AB4, Assemblymember Arambula has championed for several years to expand full scope Medi-Cal to all income eligible adults, remove the immigration status as an eligibility exclusion. So the 25 to 64-year-olds, this is what the bill will address to do. We have Medi-Cal expanded in regards to status to under 18 and from the 19 to 25. Now we need to go expand it more. That's where SB 56 with Senator Rosso expands it to the seniors above 65, regardless of immigration status. And as I understand, both those bills are in appropriation. So AB 4 is in the Assembly Appropriations and SB 56 is in Appropriations Committee as well. AB 1130 by Assemblymember Wood, this would establish the Office of Healthcare Affordability. And this office is to collect and analyze information, identify trends in healthcare prices. The office will set enforceable cost targets for healthcare affordability while aiming to improve quality and equity. The office will provide data and tools to meet these goals and ensure accountability if they don't, including the ability to levy financial penalties. Again, there's a big issue in our San Joaquin Valley, the issue of cost, of healthcare costs. So we need to get a handle on this, and this bill aims to do that by establishing this Office of Healthcare Affordability. And I believe that also is in the Assembly Appropriations Committee, having made it out Assembly Health. The next bill is here we are, AB 470 by Assemblymember Carrillo. This would repeal the medical assets test for our seniors and disabled. And this would just, by eliminating that standard, allow for more access to assets and address poverty for our seniors and disabled individuals. And that bill also is, I believe, in Assembly Appropriations, having made it out of Assembly Health. And these are bills that just address that target our communities. We know that the state helped everyone, regardless of immigration status, so undocumented, documented, to access care through the programs for testing, eligibility, screening, to get vaccines, to get tested for COVID-19. That is good, but we need to do more. We need these bills, and we need to inform and educate how these bills help our rural San Joaquin farm worker residents going forward. Thank you very much. I'll pass it back to Noah.
Thank you, Noe. So the other bill that we have on here, AB 465 from Assemblyman Nazarian, is under the same theme of Health for All and Health for All seniors. This one is particularly important to LGBTQ plus seniors, who often, a lot of people, rightfully, LGBTQ plus youth are normally the focus of who we think is being overlooked, but almost equally so are LGBTQ plus seniors as well. So this is a bill that would help address that a little bit. It's cultural competency training for professional fiduciaries. So it will ensure that professional fiduciaries are equipped to provide LGBTQ plus older adults and people with disabilities with supportive and respectful care by requiring cultural competency and sensitivity training during the licensing and education process. These fiduciaries are critical, or they provide critical services to older adults and people with disabilities. They manage the daily care, housing, medical needs, and they offer financial management services that range from basic bills to estate and investment management. It really is end of life sort of stuff sometimes. LGBTQ plus older adults are a particularly vulnerable community, and they often have fewer options for informal care and support. So AB 465 is a great bill to protect LGBTQ plus people as they age. It is a Health for All issue. And currently this one was passed by the Assembly Committee on Business and Professions with bipartisan support, and now it's in the Assembly Appropriations Committee as well, just like 470. So now I will pass it on to Katie. Thank you.
Thanks, Noah. Hi, everyone. My name is Katie Andrew, and I am with Children Now. I'm going to talk to you really quickly about SB 428, which is authored by Senator Hurtado and co-sponsored by the California Medical Association and Children Now. SB 428 will expand coverage of trauma screenings into the commercial insurance market. And screening children and adults for exposure to adversity can help practitioners identify those at risk for experiencing toxic stress. And screening in primary care settings can also help prevent further exposure to adverse experiences. And with a strong referral system in place, it can provide appropriate education for parents and caregivers about the relationship between early adversity and negative health outcomes. Currently, California provides the trauma screening benefit for Medi-Cal beneficiaries only. And the problem with that approach is that it has the potential to pathologize poverty, as only low-income families are asked about their adverse childhood experiences. And that practice is not at all supported by the research. And without expanding the screening benefit into the commercial market, California will continue to limit the ability for all families at risk for toxic stress to receive targeted interventions that can reduce the risk of chronic disease later in life and ultimately reducing long-term costs in the healthcare system. SB 428 passed out of Senate Health with unanimous support last week and is now in Senate Appropriations, awaiting to be set for hearing. I'll be sure to place my contact information in the chat in case anyone has any questions or would like to talk further about this bill. And I will go ahead and pass it back to Noah.
Thank you, Katie. So underneath behavioral health supports, especially during the public health emergency, SB 110 or 110 from the office of Senator Wiener is an essential one for methamphetamine abuse and substance abuse in general. So this one is called Confronting the Meth Crisis Through Contingency Management Intervention, which is a big word or a big long sentence, but contingency management is just another form of therapy, basically, specifically directed towards methamphetamine abuse. So this bill would require Medi-Cal to cover contingency management programs, similar to how it will cover other substance use disorder services. Many other substance abuse treatments, they require specific treatments, and Medi-Cal covers a lot of those, but they do not cover this one for the meth crisis. And it's pertinent to the LGBTQ plus community because we face higher rates of depression and mental illness in general, but especially substance abuse and methamphetamine abuse. So this is essential to especially low income and people who need coverage for treatment. Contingency management is it's a treatment that uses positive reinforcement to achieve behavioral change. It's the most effective method of an intervention for methamphetamine disorder. There's no medication-assisted treatment for it, which you could use for opioid treatments. You can't use it for methamphetamine abuse. So this is a critical tool for addressing that. It's a longstanding crisis in the LGBTQ plus community due to historical and ongoing stigma, shame, marginalization. So this bill would be a pillar in California's response to this specific public health crisis. And I will pass it on to Sarah. Thank you.
Thank you. And again, Sarai with CBDIO, continuing with our kind of recovery and the pillars to move us away from this health crisis and economic crisis that we live in is food security. CBDIO works with the farm worker in farm worker and indigenous communities, and we know that, in the off seasons and during the seasons, like there is, we have people that don't have access to healthy foods and the same fruits many times that, our farm workers harvest. So we really want to emphasize kind of two of the different proposals that will lead us to a more equitable and just food system. One is SB 125 that will enact the Equity, Economic Recovery, Health Food Access, Climate Resilient Farms and Workers Protection Bond of 2022. This is a holistic approach of, again, ensuring that, the farm workers have not only access to health and investment in health and access to housing as it will build housing. This bill is putting really $637 million in protecting health and the well-being of farm workers. $450 million will go to building housing for specifically farm workers and not only individuals, but families. And also it's gonna move us away from, toxic pesticides that continue to impact the farm worker community, because it promotes, agriculture that is sustainable, that moves us away from synthetic pesticides, that at the end of the day helps with the climate change that we're facing, as the soil will be better at protecting workers' health and the environment. And in addition to that, many of our folks want to farm their own land, and this bill will also make money aside accessible for Black, Indigenous, and communities of colored farmers and to have access to land and to receive training in a cultural and linguistic appropriate way. So again, this proposal is a very holistic approach to ensure, again, that it makes a small change to ensure that we move towards a larger systemic change to address the food security of our communities. And it's also at the same time, SB 464, Food for All, that will allow, again, the status, immigration status does not count, to make sure that everyone is eligible for California Food Assistance Program. Again, this is important, as we have seen that our undocumented population, the population that continues to contribute to the economy of our valley, of our state and nation, has access to food because they contribute to it. So again, all of this are initiatives that will really could pave a path for racial justice in our communities. At least SB 464 is moving to, has a hearing May 3rd, and the SB 125 is a 2-year bill. So I know that I will leave it to Socorro for the next slide.
Thank you, Saidi. So I'm going to be talking about, the importance of telehealth access, especially, we seen how important this was during the last year in order for folks to be able to continue to get their care. So AB 32 ensures Medi-Cal providers, including federal qualified health centers, FHQs, and rural health centers can render telehealth and telephonic care that is clinically appropriate and necessarily beyond of COVID-19. So telehealth is not new in the sense that this is something that a lot of the private sectors had been utilizing this for a couple of years now. And it's something that, health centers like Planned Parenthood and other qualified health centers had been trying to pivot into and figuring out how to access this. COVID-19 forced us to pivot from one moment to the other to utilize telehealth, and it has been a lifesaver literally for many. The problem that we're seeing now is that, unfortunately with Medi-Cal for many years, there hasn't been payment parity, which that means is that, the government is always wanting to pay less for Medi-Cal services than they would to the private sector. And there's a problem with this because, if AB 32 does not pass, then there is a possibility that payments could be politicalized, that folks that have nothing to do with medicine could decide that they feel that a visit through Zoom is more valuable than that of a visit through the phone system. The problem that we see with that is the fact that, at least with Planned Parenthood and many of our other providers, beyond healthcare, mental behavioral services, we have seen that the preference for our communities has been that of audio. That could be due to the fact that, many of them don't have laptops at home, don't have the correct internet broadband in order to access their services through Zoom. It could be for many reasons, but the fact is that the data that we have collected indicates that their preference is audio. If AB 32 is not passed, this may force folks to either go back to the old days of health inequity, where folks have to, take time off from work. They have to find childcare, they have to find transportation in order to go to a regular doctor visit, versus now where we've seen patients literally taking, say for example, a woman needs to have a refill on her birth control. She is working in the fields on her 10-minute break, and on her phone, she's accessing these healthcare services, and no longer does she have to make a choice between healthcare versus making sure that there's money coming in the door for her to go to work. So that's why AB 32 is so important. It's so important so that, a lot of the health inequities that had been sustained for decades, don't continue, in that folks are able to get healthcare in a manner that they feel comfortable accessing it. Thank you. So next, we're going to move on to Noah.
Thank you, Socorro. Noah Deeds back. So more of our ongoing priorities revolve around two big issues for the LGBTQ plus community. One is expanding investments in culturally and linguistically appropriate primary care for LGBTQ plus people, and especially transition-related healthcare for transgender Californians. Don't mind my cat. So there's, that's one of the biggest health inequities, is getting care that is fundamentally equitable for transgender Californians. We have done our own studies within our local clinics and within our own health services here in our county, and a lot of people, especially professionals and providers, are unfamiliar or at least somewhat uncomfortable with transgender people, and that, frankly, I mean, it needs to change. We need training, and we need more LGBTQ plus competent and LGBTQ plus people in general in these positions. So our other one is to call for systems change to facilitate compliance of healthcare providers with existing policies that ensure access to care for LGBTQ plus individuals. It's one thing to get certain things passed up at the state level, up in Sacramento. It's another thing to get compliance. The systems that a lot of counties have and local bureaucracies seem to not be able to accommodate new ways of doing things that accommodate LGBTQ plus people, whether that be collecting SOGI data or just general trainings. So here's a couple of our priorities and of bills that are out there right now that are working to address those inequities. One is SB 258, and that's from Senator John Laird. So this would include older people with HIV as part of the population of greatest social need to ensure that they have access to the programs and services administered by the California Department of Aging. With recent advancements in HIV treatment, people who take antiretroviral therapy can keep the virus suppressed and live long and healthy lives. So for this reason, the number of older people living with HIV is increasing. And over half of the people living with HIV in California are now aged 50 years or older. But our current medical and social service systems are not really prepared to address the unique needs of this population. Given the continued growth in the number of these older people with HIV, it is crucial that California implement effective policies and programs that address their unique needs. Much of what our own center does here in Tulare County addresses people living with HIV, and especially older people living with HIV, and getting them affordable care and medication and education as well. A lot of people stick to what they know in terms of medication when there are newer opportunities, and especially older people living with HIV could really use some updated services. So the status of this bill is it was passed by the Senate Committee on Human Services 3-0, and then now it's referred to the Senate Appropriations Committee. And that hearing just passed, so I'm not completely sure where it is now, but we're going to keep an eye on it. The next one is SB 379 by Senator Scott Wiener and Assembly members Evan Lowe and Christina Garcia. This is the Equitable and Inclusive UC Healthcare Act. This will ensure that all of the health systems underneath the University of California name contracts with healthcare facilities that allow UC staff practicing in those facilities to provide a full range of healthcare services, including reproductive and gender-affirming care. The UC system, like the state of California itself, has generally been a leader in protecting comprehensive reproductive and LGBTQ inclusive care. But UC Health has entered in contracts with healthcare facilities that subject its providers to dangerous restrictions on comprehensive reproductive and inclusive care. These types of harmful non-clinical restrictions and care usually impact patients of color and people from low incomes who already face huge barriers in our healthcare system. So this would address those inequities and allow for a more robust range of services for our LGBTQ plus population underneath the UC system. So the status of this is it has been passed by the Senate Education Committee 5-2, and it's now referred to the Senate Health Committee for hearing. And thank you, Sakaro. Yes, I am from the Source LGBT Plus Center out in Tulare County. We're located in Visalia, California. And we are a community center for LGBTQ plus people. So our next bill is also from Wiener. Wiener is our, Senator Wiener is our champion in the Senate, I would say, in California. He passes so many bills that do so much good work for us. We had a meeting with his office earlier today that went really well. So we thank you for all of the work that he's doing. The next one is Bodily Autonomy, Dignity, and Choice Act, SB 225, from Senator Scott Wiener. So this will delay specified medically unnecessary surgeries on children born with variations in physical sex characteristics, also sometimes known as intersex. This bill does not affect surgeries that are required to address an immediate risk of harm, and it does not remove parents or doctors from the medical decision-making process. What it does is that it builds upon SCR 110 from Wiener, which in 2018 called on professionals to foster the well-being and individuality of children born with variations in their physical sex characteristics, and to heed international human rights guidelines and health authorities in the United States that caution against medically unnecessary surgical procedures that carry both a meaningful risk of harm and can be deferred. I guess the more or less complicated ways, a lot of babies born with intersex characteristics or certain characteristics of their reproductive traits, a lot of times parents are uncomfortable with that, and they will make an executive decision that is not medically necessary to provide some sort of surgical intervention that may not have been necessary, that may harm the child or the person later on in their life. So this bill really does it just cautions that sort of behavior and allows our systems and professionals to heed, more of human rights guidelines. So right now, this was withdrawn from consideration, the Senate Committee on Business, due to lack of support, which is unfortunate because it is an important bill. So hopefully it can be reintroduced at some point in the future. Next slide, please. So another big thing that we champion is the collection of SOGI data. SOGI data is essential to getting a full and comprehensive picture of the LGBTQ+ population in the country and especially in California. There are many areas in which we do not collect SOGI data. If you took the census, 2020 census, you might have noticed that they lack some options in terms of sexual and gender identity choices. That's what we're talking about, basically. So that there's lack of options, whether that be in academia, death certificates getting their own preferred gender on them, and as well as just general governmental systems that do not collect this data. So one of the bills, or all of these bills, basically address this issue. AB 1094 from Assemblyman Arambula. So this is SOGI mortality data, improves the quality of sexual orientation and gender identity mortality data in the state of California. So this will establish a pilot program in select geographically and demographically diverse California counties to train coroners and medical examiners on the collection and reporting of gender identity and sexual orientation information in cases of violent death, such as suicide and homicide. When we look at data for certain, like suicide or homicide, it's hard to get a full picture of their rates, the rates at which this is happening, because they're not trained to collect this data. So it just goes down as male, female, homicide, or suicide, and we cannot look back on that data and make any conclusions about it at which, the rates that we're being affected by these things. So this would finally pilot a program where we can start to address that issue. And then, because once we have a full picture of the rates at which these things are happening, we can start making changes and interventions. Next one is AB 439. This is from Assembly Member Rebecca Bauer-Kahn. So this adds non-binary as an option for gender identity on death certificates. This will codify inclusive gender identity options on these certificates, which brings these documents in line with California's existing non-binary options on driver's licenses and birth certificates. AB 439 continues the critical work started with Senate Pro Tem Tony Atkins years ago to authorize non-binary identification on birth certificates, court documents, and driver's licenses, and to ensure that California respects people's gender identity even after death, which is huge, really. So the current status of this one, it was paused by Assembly Health Committee 13-1 with bipartisan support, and it's awaiting consideration on the Assembly floor. The next one that we have is AB 218. This is from Assembly Member Chris Ward. This is affirming records. This AB 218 will codify and streamline the process for transgender Californians to update their marriage certificates and the birth certificates of their children to accurately reflect their legal name and gender while protecting their privacy. Accurate and affirming gender identity documents are critical to preventing discrimination when, for example, if you're enrolling a child in school or applying for a loan or making medical decisions on behalf of an incapacitated spouse. There are many areas in just the general life of a transgender person in which their names are called into names and identities are called into question by documents in which they cannot reflect their true identity onto these documents, which can provide dysphoria or it's just discrimination, plainly. The status of this one is it's been passed by Assembly Judiciary Committee A3, and it's been referred to the Assembly Health Committee. And then the last one that we have here is AB 245 by Assembly Member David Chu. This is affirming transgender and non-binary students' names in college acts. So this will ensure that California's public colleges and universities allow transgender and non-binary former students to have their name and gender accurately reflected on their academic records, such as their transcripts and diplomas. This bill also very importantly provides a standardized process for doing this. Students should not be dead named, which means that they're going to be referred to by the name that they were assigned at birth rather than by their affirmed or chosen name on their diplomas and other academic records that commemorate years of hard work and achievement. That causes a huge disconnect between themselves and their true identity. So AB 245 builds upon AB 711, which is also from Chu, signed in 2019, which covers school districts, charter schools, and county offices of education. This is just bringing those same measures and standards upwards of the public college system. So the status of this is that it was passed by Assembly Higher Education Committee 11-0 with bipartisan support. Then it was passed by Assembly Appropriations Committee 12-0, and now it's awaiting consideration on the Assembly floor. So these are all great SOGI data focused measures that will allow gender and sexual identity to be accurately reflected on California state and academic records. So now I will pass it off to Katie. Thank you.
Thanks, Noah. So as part of the iHeal platform's ongoing priorities, health priorities, there is a focus to improve access to and utilization of dental services and to raise awareness of the importance of oral health, including utilizing the work of local oral health programs and county level oral health strategic plans. And one bill that we wanted to highlight that focuses specifically on racial disparities in childhood chronic diseases, including dental caries or cavities, is SB 682. And SB 682 is authored by Senator Rubio and is co-sponsored by the California Children's Hospital Association, Public Health Advocates, and Children Now. And it requires the state, and specifically the California Health and Human Services Agency, to collaborate with the relevant departments under its purview, including sister agencies and departments whose work plays a role in the health and well-being of children. and stakeholders as well to develop and implement a plan to reduce by at least half racial and ethnic disparities in 5 chronic childhood conditions. Again, one being dental caries, the others being asthma, diabetes, depression, and vaping related diseases. And these 5 conditions affect a large proportion of California children with clear racial and ethnic disparities in both prevalence and outcomes. And these result in lifelong consequences, quality adjusted life years lost, and increased costs to the state and healthcare system. And while many families are saddled by the burdens of chronic disease, families of color are up to 2 times more likely than white families to have most of the major chronic diseases. So SB 682 would again require the state to develop and implement a plan to address these racial disparities, building upon previous statewide initiatives, and resulting in a more racially equitable state for our children. SB 682 enjoyed unanimous support in Senate Health Committee and is now in Senate Appropriations, scheduled to be heard on May 3rd. So I'll again place my contact information in the chat in case anyone has any questions. And with that, I will go ahead and pass it over to Socorro. Thank you.
All right, thank you, Katie, and thanks all my peers, for all the great information. And I don't know that we say this often enough. Thank you to all of our elected officials who have authored and co-authored these legislations, and that we're fortunate enough that there is so much legislation to be voted on that is so progressive and so supportive of our communities. So now we're going to transition to the roundtable discussion portion of our program. As we go into this roundtable, I want to remind our participants, our audience, if they could enter their name, their organization, and what region they work in, if they haven't done so, just so we could know who's in the room. And then, so when we go into the roundtable, I'm going to ask a question. Each one of our panelists will have an opportunity to answer that question, and I will have them answer the question in alphabetical order for all fairness. And when we start with Holly, if you can start with your name, your organization, and what region do you cover? Okay, so we're going to get started. And Holly, if you want to introduce yourself, and then I'll be asking the question.
Absolutely. Good morning, everyone. Thanks so much for joining us. I'm Holly Grace Curry. I'm with Haven in Stanislaus County, and I use she, her pronouns we're a catalyst for individual empowerment and societal change. And we work to end all forms of gender-based violence. So Haven provides support and advocacy to people who are affected by domestic violence, sexual assault, and human trafficking throughout Stanislaus County.
All right, and so the first question is, what health policy and systems change work does your organization focus on, and how has the work shifted due to COVID-19?
Got it. We are working in partnership with our statewide domestic violence and sexual assault coalition. So a lot of our policy guidance comes through this big collaborative coalition level effort throughout the state of California. And this year, we're definitely focusing on funding and program requirements, issues related to housing and homelessness, economic justice, addressing just deep systemic problems with our criminal legal system, because domestic violence and sexual assault are intersecting with the legal system often. Sometimes the legal system is life-saving for our clients, and other times it's problematic depending on what kind of relationships communities have with law enforcement. We're also focused largely on prevention funding and ensuring long-term prevention funding so that we can stop cycles of violence and interrupt these cycles that just perpetuate through generations. And we're always focused on issues related to immigration and making sure that the most vulnerable, underserved populations can still access our services without too many barriers. I could go into more depth on each of these, but I want to leave space for others to talk about their policy areas too.
Well, thank you so much, Holly. Katie?
Sure. Hi, everyone. Katie Andrew with Children Now. So we obviously focus on kids. That is our thing. But in terms of health policy, we are really all over the map. So oral health, behavioral health, access and coverage. And I think we tend to really focus on improving access and quality of care specifically, and really focusing on children in the Medi-Cal system. And so, and how has that work shifted during COVID-19? I think if anything, it's given us an even bigger sense of urgency because the problems that we were focusing on previously have only been exacerbated by the pandemic. And when we think about things like immunizations, for example, the rates of utilization in the Medi-Cal system were already embarrassingly low. And we have only seen those rates drop even further since the pandemic. And so really trying to push the state to find ways to improve access to care and get those rates up. So I will stop there.
Thank you. Noah?
Hi.
Do you want me to repeat the question?
Just real quick, please.
Sure. But don't forget to introduce yourself and where you're from after that. But what health policy systems change work does your organization focus on, and how has that work shifted due to COVID-19?
Sure. So yeah, I'm Noah Deeds, pronouns he, him, from the Source LGBT Plus Center in Visalia, California. We also, our work extends to Tulare and Kings County. So much of what we focus on is health related and advocacy related in terms of providing, well, specifically for systems change, we are big watchdogs in terms, or I guess unofficiated watchdogs for SOGI data and compliance from our county health departments and FQHCs. We also do a lot of work around mental health, suicide prevention, food security, youth peer support, HIV support, as well as advocacy and support for other issues that are intersectional with ours. And that's especially racial justice motivated. I guess the way that we've shifted has been towards trying to open up our pathways for reaching our community members. So we have provided a lot of virtual support for our peer support groups, as well as opening up our mental health to a wider array of people. We've began, connecting people directly with services and providing direct relief, food relief, especially. We've had something going on for a year now called Food Box Friday, where we team up with another organization, Food Link, to give out food to people who need it. And we've also been focusing a lot on COVID education and helping people reach resources that they need, as well as getting them appointments for getting vaccinated. That's been, I think, one of the biggest things that we've been working on lately is making sure our community members are educated and they know how to get vaccinations. So yeah, I think that's, PrEP, of course. I always forget to mention PrEP, but that's one of our biggest things that we do is connecting people with medication for people living with HIV. And so we have a pharmacy and all that sort of thing. I think that answered most of the question.
Thank you. Noe?
Good afternoon again. Thank you, Socorro, for the question. Hi, everybody. Well, California Rural Legal Assistance Foundation, we're a statewide nonprofit legal advocacy and outreach organization. Our focus is rural areas. Our communities are immigrant, migrant, farm worker communities. And we focus on several areas: labor, immigration, housing, health, pesticides. And as regards to the health policy work, what we really focused on this year, as we knew Equity in the Mall was canceled last year, and we started right away educating and advocating on needs for farm workers. So our focus was early on around safety and protection, and then also testing, addressing testing, access to care and coverage. More recently, we've been advocating and educating through the Community Vaccine Advisory Council, the California Vaccine Advisory Committee for the state, and made up of community-based organizations informing on how to get the vaccine out to our communities. And we provided written comments and policy recommendations to them. So at that level, we were working through the CVAC, organizations. Some are on here, such as the United Farm Workers Foundation, Visión en Compromiso, Sierra Leone, and others, to get vaccines in arms and make sure they get to the hard to reach farm worker communities. And then and also doing it. Our staff in San Joaquin County worked with the community clinic there to actually do a pop-up clinic in Lodi, and got the appointments done and got people the vaccine, farm workers, low income. And then in Modesto with the West Modesto Community Collaborative, did a clinic, first come, first serve clinic on a Sunday a couple of weeks ago. And we're planning one this Sunday in series for targeting farm workers. So from policy, addressing it, to actually on the ground, getting vaccines in arms in terms of the COVID-19. On a broader spec, we still continue advocating along with our coalitions for the Health for All policies that we need to expand Medi-Cal to all, regardless of immigration status, or undocumented farm workers who are out there as essential workers particularly. A last piece that I'll add is that we advocated, and it's happening now, is the farm worker health study that UC Merced is conducting. And they're doing the work. They formed advisory committees. They're looking to do the surveying and collect that data, because the data for farm worker health is outdated. It's like 20 years old. So that's ongoing now, and that's crucial to really address policies and recommendations, systems change going forward. Thank you for the question.
Thank you, Noe. So before I go to Saeed, I just want to remind folks, if you have any questions, you could put them in the chat, or you could raise your hand and we will unmute you. So like that, you don't wait till the end and perhaps take the chance of forgetting what question you were going to ask. So we got our partners who are looking out in case you do enter any questions in the chat, or like I said, raise your hands. And Saeed, your turn.
Thank you. Again, my name is Sarai Martinez. I'm the Executive Director with Centro Binacional para el Desarrollo Indígena Oaxaqueño. And we serve primarily the indigenous farm worker communities in the Central Valley and the Central Coast of California. We're about 160,000 indigenous farm workers that were identified back in 2007. That was the latest study that came out, but we know that our community continues to be counted. And that, is usually this assumption that, if you look Mexicano, then you speak Spanish, but there is a huge linguistic and cultural diversity among immigrants, not only from Mexico, but from other parts of Latin America. So it's definitely, I think our work has been focus in ensuring that we highlight the racial disparities among our community that have been subjected not only in the United States, but even coming from Mexico, and how that has shaped the different inequalities that we lived. Prior to the pandemic, we continue to be invisible. So CBGIO really works around to bring visibility to the issues, and also to ensure that we advocate for systems change. And I think the pandemic has been very clear that things need to change and we cannot go back to the normal. And a lot of our work has, again, focuses on talking to farm workers and organizing in with the pandemic. We have been part of many efforts across the San Joaquin Valley and the Salinas Valley, but we had also be part of the beginning. We interview farm workers, indigenous farm workers, about how COVID-19 has impacted them. We did over 300 interviews with indigenous farm workers, and there are clear inequities that show the study, the COVID-19 farm worker study, that are also guiding us in terms of what areas we should focus on. And in terms of health, we know that language justice is an issue that we continue to advocate. We knew that our community does not have language access when seeking for care or other services, and that there's no capacity at the health level, institutions, or any other institutions to document the language needs of our communities. Right now, again, so all of that experience from our community on not accessing services really impacted now with COVID for our community to go and seek for health services, and it continues to have that impact, and will continue to have it beyond COVID. So we're working with and advocating at the county level, not only in Fresno, but Madera and some in Tulare too. We have about 40 community health workers, or community workers that came from farm worker background, were formerly farm workers that are doing outreach and education, building capacity really in our farm worker community to ensure that they know their rights and they also know where to go and access care, and that we are there to support them with that language support. So we have built and organized testing events since the beginning of the pandemic. We have been also building and be present in organizing vaccine events, and been advocating at the state level to ensure that we have equity in terms of COVID resources and COVID, again, help support for that community. And among our community, and also thanks to the support of the San Joaquin Valley Health Fund, Centro Binacional has been able to distribute unto this date over $3 million for undocumented indigenous farm worker communities in direct economic relief to ensure that, again, we support our community that has been invisible within the farm worker community. So those are some of the priorities that, because of COVID, it has shifted. But I think the language access piece and the language justice, if we address that, it will help in the long term to ensure that our community has access to care.
Awesome. So before we go on to the next question, since I'm playing dual roles here, so Socorro Santillan, Director of Public Affairs for Planned Parenthood Vermonte. We actually serve California from Bakersfield all the way to Reno, Nevada. I oversee the Stanislaus County all the way to Bakersfield County. And, the three areas that Planned Parenthood works in are, the most known is our healthcare. We are a healthcare provider and have continued to do so throughout COVID-19, including that of vaccines and testing for COVID-19. And we do education. All of our education pivoted from in-person to virtual education throughout California. And then the third is advocacy. We do voter registration. We did census work. We do just about anything under the moon in regards to policy and systems change. And basically, we continue to do so throughout COVID, just in a different manner, like all of the rest of our partners, which basically was mostly through Zoom and virtually. So we're going to go on to the second question. And the question is, what new issues have been identified because of the pandemic? And we're going to start with children now, either Katie or Eileen, whichever wants to take on this question. Thank you.
Thanks, Socorro. So again, Katie Andrew with Children Now. So I've already spoken a little bit about the utilization rates for preventive services for children and the significant drop that we saw in the utilization of those services due to the pandemic. And unfortunately, the starting point, the baseline for that was already very low. So I won't continue to belabor that point, but I think one of the other things that we are really concerned with as a result of the pandemic is being able as a state to meet the immediate behavioral needs of children as they return to school. There are a lot of proposals in the governor's budget to sort of address this. Unfortunately, we see a lot of those proposals as being more long-term solutions, and we really see that as kids are going back to school, there is an immediate need. And so one of the things that we've been working on is a budget request for $80.5 million to provide financial support for school-county partnerships, so schools and county mental health to partner so that they can be sure to provide those supports now. Rather than a year from now, and so that is something that we've been working on this budget season. So I will stop there, and Sakara, if you want to ask the question, the next person.
I promised I wasn't going to do that, but so yes, is there anybody else that would like to answer the same question?
This is Noah. In terms of school children and parents, farm workers, undocumented, limited English proficient, it is a real issue, challenging issue in our rural, isolated, unincorporated school districts, particularly. We know that parents want their kids to go to school safely, that they're protected. They want to know that what the school's doing to protect them, and also what the school's doing to vaccinate and protect the teachers and providing services. At the same time, there is stress, mental stress going on within our farm worker communities, the parents, in understanding that. And so there's that real issue. There's also continues to be a gap in what is being provided by counties. What are the eligibility factors, undocumented, mixed status families eligible for like rental assistance that's going on, or can you get food assistance, utility assistance? And so that information needs to continue to be flowed to our families and children, because they know that they need to go to school. And some of the schools are more responsive and are meeting with parents to listen. We just convened in a small school district, the superintendent with electeds from their school board with parents, and so that they can communicate, they can dialogue, and then the school can then, as a champion, also reach out to the elected officials at the county level to help them understand that they need to help support our families. So connecting funds and policy onto the ground to help our farm worker kids be how we say in Espanol, éxito escolar, so they could succeed, right, educationally, because that's the goal, get our kids educated so they can have the quality of life and help our communities. So it is very real, and it's going to be an ongoing issue as resiliency continues on the next year or years.
All right, thank you, Noah.
The digital divide intersects right here. That's a perfect example. And we know through the policy platform that's being addressed was a panel on it yesterday at Equity on the Mall. So the intersection with equity, with digital divide, health and mental health, and just services and resources for our families and children.
Thank you, Noah. So we have a question from the audience and I want to make sure that we answer it. The question was addressed to Holly, but if anybody has the answer, please help. Where do we refer clients in San Joaquin for specialized medical care and assistance with high cost medications that is critical to their being healthy?
Socorro, I think that Noe answered that privately in a chat, but Noe, is it accurate that you offered to be a contact for folks needing this information?
Okay. All right, thank you, Noe.
Oh yes, thank you very much for that question. Yeah, thank you.
Others may have the same question though, so I'm going to go ahead and copy your contact.
So we can network the question, but I was happy to connect with one of our staff attorney who specializes in immigration and health. And that's her region, is San Joaquin County.
All right, and we have time for one more question. Instead of having everybody answer, those of you who want to answer the question, feel free. What makes the region you work in so different from Sacramento? Does anybody want to take that on? Well, I can tell you that my region, it is more, especially for my position, which is working with our advocacy base, it is so much more difficult to organize in our community. For one is that we have a large community of immigrants who are not, used to being able to speak up, who live in fear and try to live under the radar. And so for them to speak up for what they really need and rather what they're getting is very difficult. Also geographically is a huge challenge because the regions that I work in are made up of so many rural communities that it's difficult to organize in those communities. And, it's different in the sense too that, a lot of in the Bay Area, a lot of folks, since they're young, they're growing up being advocates because this is what they see. So they model that. And so even working with young people in the Central Valley, sometimes it's a little harder because what they have learned to this point is stand in line, be quiet, don't ask questions, and you'll get through things, just right versus, if you don't like something or something's not right, speak up. And so those are some of the things I see in my region. Anybody else?
I'll go real quick. We kind of mentioned it already, that there's a huge digital divide between community members, especially in our rural communities that have been very hard to reach, especially during the pandemic. We're also a very, I think, demographically different than Sacramento, as well as culturally, I guess, or politically. We are, the LGBT plus center was kind of unheard of to even think about ever existing, even like a decade and a half ago. And so there's been a lot of attitudes that we've had to shift and to work around in order to provide all of our community members with the health and services that they desperately have needed. There's a huge disparity in health outcomes and access here as well, especially for LGBTQ plus and BIPOC and immigrant community members. So yeah, I think I'm not super familiar with how Sacramento is placed, but I know what Tulare County is like in terms of what it feels like and what it looks like here as well. We were some of the worst impacted by COVID-19 as well, and I feel that a huge majority of our community, not majority, but of our community members who are marginalized are invisible. And I think we're working past that, but it is hard to get like I've said earlier, getting these bills that are passed that are, for our community members and are supposed to help them, not being complied with here at a local level. So there's also just, you know, like a slowness to how everything moves here. That's all I got. Thank you, Scar.
Thank you. So it seems that we are out of time, but for next steps, we want to make sure that you participate in other sessions of Equity on the Mall. You know, we have a lot of incredible partners that are going to be presenting on their issues as well. And you're welcome to join our legislative visits. We will continue visiting our elected officials throughout the work to make our case and hopefully gain their support for the legislation that was described in our presentation. And also, if you feel like, you know what, I want to join the Health Committee, I really support what they're doing and think I could contribute, connect with Diana, and she will make sure that she gets you on our listserv. And so when communications are going out, you are included. I want to give a chance to my partners, if any of them have any last words that they really want to put out there, or any comments.
Well, I didn't know it. I just would like to thank you, Socorro, for moderating today. Holly Grace for helping us with our chat, and Noah Deeds with just the vaccines, technical assistance, and our producer director. We should nominate him for an Oscar. That's Brian Fox. Eileen with her coordination skills is just so valuable, and just the relationship, communicating, helping us stay on track. Sari, your expertise, the language assistance that we needed to keep that on track. And Katie, with your policy work you're doing, that's fantastic, you know, for our kids in the San Joaquin Valley. And all those behind the scenes, the San Joaquin Valley Health Fund, our Health Foundation, who would say EIC is helping us as well. With the technical assistance. So, and then just the partners for this health subcommittee. Thank you all for all your work. Keep it up. It's fantastic. It's exciting. Our communities deserve to be lifted up. Thank you very much. Holly Grace, I got you. Yes, I think I got everybody. Thank you all.
Thank you, everybody.
Thank you. Have a great day.
Be well.
Thank you.
You guys did amazing. Thank you so much. Good job.
Do we need to stay on and say anything, or we're just all leave? We need to do any debriefing? No.
I don't think there's anything else to do, Noe. We're gonna stay on, and we're gonna make sure we get the chat and the recording, obviously. Oh, actually, let me stop recording. I can do that now.